Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. I'm Dr. Nouman Tehseen and I'm working as a general practitioner in Adelaide. Today I will be talking briefly about the role of antibiotics and why it is important to complete the course and how it is important to take them as prescribed. To start with, antibiotics, the discovery of antibiotics has been a major advancement in the medical fields. Before the discovery of antibiotics, there was a tendency of even the minor infections to become fatal and claim millions of lives. But now we see that antibiotics save lives every day. So the effectiveness of antibiotics depends not only on their proper prescription, but also on the proper use of the antibiotics and completing the course. When the antibiotics are started initially, they work by killing bacteria. But the bacteria, the whole lot of bacteria in an infection is not the same. There are many different type of bacteria, some of which are very sensitive to antibiotics. So the antibiotics start working by killing those bacteria first, and the person starts feeling better. And they may think that as they are feeling better, there is no more role of antibiotics. So they may stop the antibiotics, but that is not the truth. What happens actually when the antibiotic is stopped, the bacteria which are more resistant and more resilient tend to survive for longer periods of time, and they tend to reproduce more. And they develop into more resistant bacteria, and due to this the infection can return in more severe and aggressive form. It is particularly important in emergency situations when the people need antibiotics to fight fatal infections, especially in hospital environment, when they need IV antibiotics. In that situation, the first line of treatments and the drugs may not work, and this leads to a major problem in developing of the multi-drug resistant strains of the bacteria. Similarly, this is important in Ramadan. If someone has to take some antibiotics due to any infection, it is important to use them as prescribed and complete the course. Sometimes the antibiotics are given 2 or 3 times or 4 times a day, so it is important to follow your health practitioner advice and to complete the course as advised. So this is not only important to save the effectiveness of the drugs, but it is also important that in the community as a whole, we reduce the development of multi-drug resistant strains or germs. Completing antibiotics is not just about feeling better, but it's all about preventing complications, reducing resistance and protecting antibiotics. So they continue to save lives even for future generations. I wish everyone very good, healthy and blessed Ramadan.